isolation. And today has been designated as a National Day of Observance for COVID-19. Like only a few other events in our lifetime, the moment we recognized last March that our world had been turned upside down and our lives would be forever changed will stay with us forever. As we mark this difficult anniversary, I remember those we lost, those who have lost so much, and all the things that could have been, but never will be. I yearn for normalcy, the laughter of my children hanging with friends, celebrating special events with members of my community, the adrenaline of crowds, and the serenity of knowing that the threat of the virus is gone, and my family, friends, and community are safe. Despite the temporary setback our community is now facing, this anniversary is also a time of hope. Our seniors, frontline healthcare workers, and Indigenous populations are being inoculated. Vaccines are rolling out in significant numbers, and thousands will be vaccinated in the next few weeks. Hospitalization, ICU admittances, and fatalities have thankfully all been declining. This past year, our residents have stepped up and been making the sacrifices necessary to keep us all safe. Frontline workers have braved the risks and ensured our essential services have been maintained. Our healthcare workers have cared for us, attended to those of us who have fallen ill, and protected the community. Heroes, one and all. In my lifetime and in my career, I have traveled many roads, seen many things, but nothing has made me more proud than seeing the people of the Peterborough region coming together and battling this scourge that is COVID-19. Soon, we will be building back better and stronger with love and compassion. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Andy, and definitely an important anniversary to acknowledge today. And before we get into more of that, we will invite Dr. Salvaterra to walk us through these next few slides with a current update on the COVID situation locally. Please go ahead, Dr. Salvaterra.
Thanks, Brittany, and thank you, Mayor Mitchell. So as of 4:30 p.m. yesterday, there were 81 active cases in Peterborough, and that's 18 more than we reported last Thursday. Our total count stands at 745 cases to date. Variants of concern continue to make up the majority of the new cases being reported to us, and as you can see, we now have 89 presumed VOCs. The number of high-risk close contacts that we are following has declined just a touch to 220, down from 241 last week at this time. Our next slide is showing you our new cases reported to date. So 4 days into the week so far, we are reporting 28 new cases, but you can see that last week we had reported 69 new cases, one of the highest weekly case counts so far in the pandemic. Much, but not all, of those related to Severn Court and the Champlain outbreaks. Next slide, please. This slide is showing us our epidemiological curve. It was starting to flatten, but now moving up again. Hopefully we can look forward to seeing this level off soon as the outbreaks come under control. As far as our exposures, the number of exposures linked to high-risk contacts continues to represent an even larger share of our total cases. It's up to 76% this week. This reflects the swift work of our nurses in identifying close contacts so that they can self-isolate. It also demonstrates how highly transmissible the variants are, with so many household contacts becoming infected. The number of pending cases is also less than last week, down from 12 to 9. Next slide, please. We continue to see lots of testing in our community, with 750 more people being tested last week, bringing our total to 44,500 local residents who've been tested at least once. Next slide, please. We have 3 active outbreaks in our community. The Severn Court outbreak has 56 associated cases as of this morning, and one of whom remains hospitalized. The Champlain College outbreak has 8 cases linked to it. The Regency Retirement Home outbreak is stable, and surveillance testing has been completed for staff and residents. Next slide, please. So here you can see our weekly case incidence rate. We are sitting at 46 cases per 100,000. This is one of the indicators used by our Chief Medical Officer of Health to determine which zone in the public health framework we should sit. The map currently shows the color zones of all the health units in the province, and I'm hoping that if we can stabilize our numbers, that we can remain in red going into next week. Next slide, please. Oh, I guess we'll finish, with the previous slide, unless you want me to go ahead, Brittany, and make my remarks.
You can go ahead and make your remarks now.
Okay, so let's do that. So then if I can have the next slide, please. Today is a somber day as we mark the anniversary of COVID-19's official designation as a global pandemic by the World Health Organization. It was only 4 days later, on March 15th in 2020, that we reported our first local case here. Before the end of the month, on March 26th, we reported our first case in long-term care, and on April 12th, our community lost its first soul to COVID-19. This is an important time to mark the loss of life here and around the world, and the dramatic changes to our daily lives and livelihoods due to the public health measures that have been necessary to contain the spread of the coronavirus. At the same time, this experience has also revealed our collective resilience, the immense kindness of others, and has compelled us to find hope in dark times. I know these last 2 weeks have been difficult for many of us as we faced a setback with our recent outbreaks. Many are angry that we've gone into the red zone. Others are tired of the prolonged limitations due to public health protocols. And some are anxious about the speed or lack of speed of the vaccine rollout. While these feelings are understandable, I encourage everyone to remain hopeful, and there are many good reasons why. On January 26th of this year, we immunized our first local resident with the COVID-19 vaccine. We have since vaccinated thousands of our most vulnerable residents and priority healthcare workers, and we've completed second doses in all of our long-term care homes. The supply of vaccines is beginning to increase. More vaccines have been approved, including the AstraZeneca and the Janssen vaccines, helping to augment Ontario's vaccine supply. This means that we can start planning for the phase 2 vaccinations to ramp up, as shown here on this slide. Here you can see when each age group will become eligible for vaccine. In April, we will begin immunizing people over the age of 75, and by the end of that month, people over the age of 70 will be eligible for vaccine. Also in April, those with specific health conditions and their caregivers will be able to get vaccinated. In May, we will invite people over 65 to book an appointment, and then those over 60 will become eligible by mid-May. By June, we will be able to vaccinate everyone who cannot work from home. But to focus on the immediate priority at hand, adults 80 and over will be eligible starting next week with the launch of the provincial COVAX booking system. Next week also marks the start of our mass immunization clinics in the city and county and at the Evinrude Centre and Norwood Arenas. With the launch of the COVAX booking system next week, please be aware that if you have a Photo Health card, you've already been registered in the system. You do not need to pre-register. COVAX will only allow access to the appointment scheduler online or by phone for each group once they've become eligible. We will advertise widely when each group will be able to book appointments. And it is important to understand that once you become eligible, you remain eligible and can be immunized whenever it works best for you. So you won't lose your place in line if you don't get immunized immediately. And please rest assured that we will have enough vaccine to complete each age bracket. So once it's announced, there's no rush to get an appointment. I tell you this in preparation for next week in hopes that we don't crash our system. So please, no need to panic. Although the booking system will open on Monday, you can relax and you can take your time. There will be lots of appointment availability for you to choose from. I would also like to point out that we are only able to run these mass immunization clinics thanks to the support of many volunteers, including dozens of student nurses from Trent and Fleming who will be assisting us. I extend my sincere thanks to those students from the health services programs and others who are rising to the occasion to support this massive immunization effort. As a bonus, Peterborough is one of a few communities engaged in a provincial pilot where primary care providers will be inviting their patients aged 60 to 64 years to receive the AstraZeneca vaccine. AstraZeneca is not currently recommended for people over the age of 65 or for Indigenous people, but only requires refrigeration, so it's an appropriate one to use in doctors' offices. The pilot will help pave the way for others under the age of 64 to be vaccinated at their doctor or nurse practitioner's office, as well as in local pharmacies as the vaccine supply increases. With the warmer weather coming and the increasing rates of vaccinations, there is much to be hopeful for on this significant day. Thank you.
Thank you very much, Dr. Salvatierra. Okay, so we will now move over to our elected officials, and we have many who have been able to join us, which is lovely. We'll start with Chief Carr from Hiawatha First Nation. Chief Carr, if you've got any comments to share, please go ahead, and I'm happy to spotlight you on the screen if your camera's behaving.
Okay. Hi, Brittany. Good afternoon, everyone. I just wanted to say a few words in regards to the incident that has put us into the red zone. And but first I'd like to, as I'm always taught, to give thanks. And that is to everyone. There's so many people to name, so I will just put that out there and to say to everyone who's working so hard in each of their communities, and to everyone who lives in our communities for doing what they need to do to keep us all safe. And for that, we're always grateful. And you know, and I say chimigwech, which means big thank you in my language, to all those people, because it's been challenging. And with today marking the year of being declared a global pandemic, my need for that, I didn't realize it was a year today. I knew it was getting close, and the traveling was stopped, but I need to do that and put down tobacco for all of us, all of our communities, and say those prayers that we can continue to be looked after, and to look after those who have lost loved ones and who are having challenging times during this time, and to know that it's going to get better, it's going to get brighter, and those vaccines are one piece of that as we continue to move forward. But I know that the recent incident that caused us to move into the red zone has, created for us further restriction and has had negative impacts on personal lives and businesses. And it's caused fear and anger and disappointment. And I think it's important to acknowledge those people's where it's had negative impacts on. It's important to not acknowledge those feelings, but it's also very important to remember that as a greater community, and I speak from my First Nation and how we're taught, but we must remember that we have resiliency and strength, and to use forgiveness. When we carry fear and anger, we carry bad medicine. It's what we call bad medicine because it affects us internally. And we need to forgive. And forgiveness is for you. It's so you don't carry that bad medicine. And use what we call lateral kindness. And then when we do those pieces in forgiveness and be kind, then we carry good medicine. And those pieces are really important as human beings in moving forward, to be kind to others and kind to ourselves, as Mayor Mitchell always says in his words. So let's remember to stay focused on moving forward, to get back on track and on what we are trying to achieve and what we already know how to do as a greater community. I know I'm coming from the perspective again of my First Nation, but we are a greater community. And we've done this before, and we can continue to do it and support each other, and we'll get through this together as we always have and as we will continue to do. So miigwech, and thank you, everyone.
Thank you very much, Chief Carr, for your wise words today. And okay, I see that MP Mary Monsef has been able to join us, and if you're ready to share your remarks, Miriam, I'm happy to invite you to speak next.
Thank you so much, Brittany. Hello, colleagues. Bonjour, Anin. Salam alaikum. Chief Carr, I'm choked up, so forgive me, colleagues. I'll get back on track, but thank you for that wisdom and for your good words about forgiveness. Colleagues, I'll begin with gratitude too, to thank Dr. Salvatierra, to thank Mayor Mitchell, to the heroes on the front lines of the pandemic, our healthcare workers, to the entire team at Public Health. I imagine you have not slept for well over a year. We appreciate you, and we're going to work very hard to make sure that your caseload and workload goes down. A year ago, the World Health Organization declared the pandemic that is now too common in our daily vernacular. It's changed the course of our lives, and the Prime Minister declared today as the National Day of Observance. On this day, we come together virtually to acknowledge all that has been lost and to grieve together. We are mourning loss of loved ones, livelihoods. We're mourning celebrations and graduations and weddings and birthdays that didn't happen. We're also recognizing there's been a loss of innocence for all of us, particularly for our children and youth. Women have been hit hardest by COVID, and we're seeing that racialized women have died due to COVID disproportionately higher than others. We've also seen women, particularly racialized women, step up against the pandemic, and the fight has been on backs. Women in our own communities, just look at them, are stepping up and rising to the occasion and taking care of the rest of us. And I agree with Dr. Salvatierra. There is a lot of hope to be found. There is hope in that our democratic institutions are working and they are strong. There are 4 vaccines safe to be used here in Canada. We are moving very quickly and ramping up with access. Every Canadian will have access to 10 doses of the vaccine, free of charge. And by September, every Canadian who wants one will get that vaccine. We're seeing the vaccine roll out in First Nation communities in our own region. We're also seeing the rollout in long-term care homes. And I too want to echo Dr. Salvatierra's gratitude to the volunteers, particularly to the students who've stepped up to say, we want to be part of the solution. There's a lot of hope also in the increase in supply of vaccines coming forward. As everyone is aware, late last week, the Janssen vaccine was approved by Health Canada. This is a single-dose vaccine by Johnson & Johnson. Canada has in place an agreement to purchase 10 million doses, and we anticipate delivery before the end of the summer. As I said last time we connected, the shipments continue to ramp up. This week, we're receiving 911,400 doses of the vaccines. 444,600 of them are Pfizer, and 466,800 are Moderna. Next week, we'll receive another shipment of Pfizer, and the week after, the week of the 22nd, we're scheduled to receive another 1,194,570 doses of the Pfizer vaccine and 846 doses of the Moderna vaccine, for a total of 2,040,570 doses in that week alone. These increased shipments are a result of the extra 1.5 million doses that Pfizer is providing during the month of March that the Prime Minister spoke about last week. For the next few months, until these vaccines are rolled out on a broader scale, we need to make sure that we continue to follow public health advice, and especially more so because of the arrival of the variant in our region. I know everybody's mourning many different ways of loss, but there's to be hopeful. And the most important thing is that we are a country, and when times are tough, we come together. And I'm so proud of my community for making the sacrifices, for looking after each other, and for helping to get vaccines into arms. Things are going to get better. We will build back better, and we'll do it together.
Thank you very much, Miriam. Excellent. So we will now look forward to hearing from our municipal reps, and I see that Mayor Therrien has been able to join us. So Mayor Therrien, if you have any remarks you'd like to add, please go ahead. Otherwise, we can come back to you if there's any questions.
Yeah, no, thank you, Brittany. It's great to be here. Thanks so much. The weather is nice, so although it's a somber day, there is light at the end of the metaphorical and kind of literal tunnel. So we've heard a little bit about the vaccines and the appointment rollout. So the city's working through our public inquiry center to help with public health in terms of when the phase 2 rollout is starting, for people to be able to book appointments through a call center as well as through the provincial's online system. So we're not quite there yet. And those appointments, as have been said, are for 80+ populations. So we're trying to hold off on everybody else so that things aren't inundated at this point. But the process is moving along, and as we've heard, needles are getting into arms. So that's a good thing. We're also, again, as the weather's getting warmer, we're thinking fondly about what the summer is going to bring. So the Downtown Build Committee, which is responsible for looking at how to make our downtown safe and how to make sure that we're able to have those outdoor patios like we were last year. We're starting to contemplate what things are going to look like for this summer. As well, there's been discussions. There was a report on Monday at General Committee about potential events at the Memorial Center, kind of drive-in concerts. There's also been conversations at the Community Recovery and Resiliency Committee that some of us on this call are part of, about how we might take advantage of the fantastic trail system that we have in our city and county, as well as the amazing artists and musicians. So there's some talk about what we might be able to do in terms of having some of those outdoor events, ensuring that they're safe. So again, I know everybody's keen to get back outside and back with the joy of crowds and hearing music. So we're working on trying to make those kinds of things happen. In the meantime, we're still in the red zone. We're still asking folks to abide by all the health guidelines that a year in we're very familiar with. I know, and as Chief Carr said, and Shimigwech, for your good words, Chief Carr, there is a lot of frustration with what has happened. I think it's also important to note that we want to ensure that public health are able to do proper contact tracing, and by having, sort of really vitriolic, anger towards students, people are going to be hiding symptoms, or they're not going to be telling, accurately about sort of their stories. So we need to have a balanced approach to it to make sure that we're able to hold people accountable for abiding by guidelines, but also making sure that we're able to properly contact trace and prevent any further spread that way. So I think I'll leave it there for now, and I'll be around to answer any questions. Thank you so much.
Thank you very much, Mayor Therrien. And now to bring us the county perspective, very pleased to have Warden Jones with us today. So please go ahead, Warden Jones, with your comments.
Okay, thank you very much again for having the county along for this very important session. And again, I'd like to salute Dr. Salvatierra for the leadership that she's shown for all of us. It's very much appreciated, and we can't take it for granted. At the risk of being repetitive, other people have certainly touched on this, and rightfully so. Today's the National Day of Observance to honor lives lost because of COVID-19. And we at Peterborough County have produced just a short, very sincere video that we have now on our webpage that salutes today. And I think it's important that we all take time to remember all those who lost their lives. Losing a loved one at any time is hard, but to lose them to COVID-19, the pain of the loss must be so much deeper, with a family not even being able to say goodbye. As a community, we do remember. We need to let people know that we do remember, and we mourn with our family and our friends, and we want everyone to know our thoughts are with you. So Peterborough County hopes that you'll join us today to honor the memory of those lost. And let's be very thankful to our full community to continue to make sacrifices to fight this virus. There are so many, from so many different aspects of our community, who are doing the right thing. And we say thank you to each and every one of them. We will get through this. We are in this together, and there are better days. Thank you all.
Thank you very much, Warden Jones. So I will now spotlight Dr. Salvatierra on the screen, and we will move into our media questions. I would just ask that media start with their questions for Dr. Salvatierra, and if it involves bringing in any of our partners who are also on the line, she can certainly invite them to comment. So let's start with Paul Rellinger. If you've got some questions, Paul, go right ahead.
Thanks so much, Brittany. All my questions are actually for Dr. Salvatierra. I have some vaccine questions, if I could, but I wanted to start with, there was a posting on Facebook that got a lot of traction and resulted in a lot of anger about a gathering, or photos of a gathering at a downtown nightclub that happened recently. And I'm just wondering if you're aware of that, and if you are, if it's being investigated or looked at by either Peterborough Public Health or City Police.
Well, thanks for that question. I'm not on social media, so I'm not aware. I wonder, not to put you on the spot, but I wonder if John Lyons might have anything to say about that particular shop.
Yeah, and thank you for that. I should mention that I'm pretty sure some calls were made to Peterborough Public Health by people that were concerned, so that's why I made the assumption that you did know about it. So
okay, well, let's see if our police know about it. John, would you have anything to say about that?
Yes, thank you, Dr. Salvatierra. And Paul, yes, it was looked at. It was found and determined through public health, through one of their investigators, that they're old photos from approximately a year ago that were not as recent as they may have been selected to be. So it kind of turned out to be that it was not as fresh or as current as social media had led it to seem. So it was dispelled.
Oh, okay, and that's good to know because there was really no indication on the post when those photos were taken. So I just thought it best to ask the question, but that's pretty reassuring. And I guess what kind of added to my question was the fact that the Junction had taken down the post and their Facebook page at the same time. So clearly nothing happened there then. Correct.
And the owner took, he was quite concerned of that circulating in the community and definitely was very cooperative in that situation. So. Perfect. I appreciate it very much, John. Thank you. Thanks, Paul. For Dr. Salvatierra, just a couple of questions about the vaccine, and in particularly AstraZeneca being allocated to Peterborough doctors. I believe, from my numbers, there's a total of about close to 30,000 doses being split up to about 5 or 6 different regions. Mm-hmm. And based on that and a proportional representation, my number is Peterborough would get around 470, 500 doses. Do you know what the number is of doses of AstraZeneca our doctors are getting?
I do know, and you'll be happy to hear it's 4,500 doses, and I expect them to arrive here tomorrow. So our doctors are going to have 4,500 doses too? Yes. Yes.
Oh, okay. All right. And then my next question is, do you know how family healthcare providers or doctors are prioritizing who gets the calls for vaccine appointments?
I don't. This is going to be up to them, Paul. It's truly a pilot, and I wouldn't be surprised if they're trying different things. But what we don't want is we don't want people phoning their doctors asking for a vaccine. So you're going to have to be patient. And if you get the call, then it'll be up to you if you would like to have the AstraZeneca vaccine. As I said earlier, it's not recommended for people over the age of 65, which is why we're not offering it to older adults. And it's not as effective as the messenger RNA vaccines, but it's still a good vaccine. And part of the pilot is to see how much demand there is for AstraZeneca. And so we'll be able to tell in about 2 weeks how many people actually preferred to get vaccine sooner rather than later, but with the fact that it's just not as an effective vaccine.
Okay, perfect. And one more thing just regarding AstraZeneca. You probably saw this, although it was recent, I think last night or this morning, that Denmark has actually suspended use of the AstraZeneca vaccine because there was reports of blood clotting and what they suspect is one death related to the vaccine. I don't know how much of that is true, but I guess the point I'm getting at is people read those things. How concerned are you that whether it's true or not just undermines faith in the vaccine itself for local people?
Well, part of the benefits of doing post-marketing surveillance with vaccines is that we give them in the millions. So, for example, in the U.S., they've already immunized like over 90 million people. And that's 90 million doses of vaccines that we now know, have a better sense of at least, how safe they are or what the actual risks are. So it's important that these kinds of events be reported. You can't always attribute them to the vaccine. Sometimes it's just a temporal association. You know, people got vaccinated on one day and something happened the next day, and you can't link the two, but it needs to be investigated. So certainly it is not uncommon, Paul, that if you do have a significant event, that you pause the use of either the whole vaccine or that lot number until you can determine whether or not there was a link. So it doesn't surprise me, and I look forward to learning more about what happened in Denmark. So thank you very much for bringing that to my attention.
Okay, and thank you. And one more thing. Where is the plan at right now? Because we're hearing about it in other regions for pharmacy distribution in our region.
So the pharmacies are also piloting this week, and there are only 3 locations in Ontario where that's happening. That's Windsor, Essex, Kingston, and Toronto. And in those areas, they've done, I think in some, they've chosen certain neighborhoods, for example, high-risk neighborhoods where they've had a high incidence of COVID, to offer the vaccine through the pharmacies there. We'll see how that pilot goes over the next couple of weeks, and then we should hear what the provincial policy decision will be as to which vaccine and when. I truly suspect that we are going to see AstraZeneca vaccine being offered here in our pharmacies, and I suspect that the pharmacies will play a big role in our vaccine rollout, just as they do with the universal flu immunization program. Here in Peterborough last year, they delivered over 20,000 doses of flu vaccine to our population, and I have no reason to doubt that they're going to be as good or even better at delivering the COVID-19 vaccines once they get their supply and get the green light from the province.
Perfect, Dr. Salvatore. Thanks so much for your time today.
Thank you very much, Paul. And I can actually add a few, fill in a few gaps there. With regard to the AstraZeneca vaccine, it's also a great opportunity to promote the March 18th event, the live streamed public education webinar that Dr. Salvatore is running next week, if people have questions like that. So thank you for making us aware of this likely question that we'll get. But if anyone in the community wants to find out more about the AstraZeneca or the Janssen vaccines, that's taking place on March 18th at 6:30, and people can register through Eventbrite. And just to follow up as well with regard to the nightclub photos, this was something that Peterborough Public Health was certainly aware of. The photos in question did come through some of our social media channels as well, and we did engage our manager of inspection services, who was aware and then partnered with the police for the follow-up. So again, thank you to our police partners for that. But we certainly were aware of that particular situation. Okay, I'm now going to invite Matt Latour from Oldies and Freak Radio. If you've got some questions for Dr. Salvatore, please go ahead.
Yeah, I've got a couple for Dr. Salvatore. I know you mentioned if we hold steady, we should stay in the red zone for next week. Do you know if we're close to being moved into a gray zone with our current numbers?
No, I mean, our incidence rate, as you saw, is at the lower end of red, Matt. So we're seeing, certainly with the outbreaks, we're seeing fewer cases per day. So I'm hopeful that we can stay in red for at least a little while longer.
Is there a minimum time that we have to stay in red before the possibility of moving back down?
Typically, they want you to stabilize, so it's at least a couple of weeks. So it'll be at least a couple of weeks, I would believe.
And I know there's been a lot of talk lately about the potential of an OHL season and each team kind of getting a medical officer of health to sign off on them being able to return to play. Have you had any contact with the OHL or the Peterborough Petes?
Personally, no. But that doesn't mean my staff hasn't been contacted. We'll have to take that one away for you, Matt, and check to see if that's happened.
Perfect. Thank you so much.
Okay.
Great. Thank you so much, Matt. Okay, I think we've got Taylor Clydesdale from Peterborough this week in my Kawartha on the line. Taylor, if you've got your questions, please go ahead.
Yes, awesome. Thank you so much, Brittany. Maybe just to start out with, for Dr. Salvatore, we can talk a little bit about the fact that, we are a year into this. And what are your observations in terms of, people being fatigued and tired by the pandemic? Because you're seeing a lot of people just saying, they're so kind of beaten down by all of this. And are you seeing that affect compliance with the rules?
Well, I think I'm not surprised, Taylor. Not only has it been a year, but we've just come through another winter. And everyone, we talk about spring fever. I guess we won't use that word this year. But we all know what it's like when weather warms up and we are tired of being indoors and tired of being on our own. So I do think I'm glad for the good weather. I think we know that it's less risky when we are outside, as long as we do maintain our distance. So I'm hoping that the weather will bring us a little bit of respite so that we can get out and take benefit of our beautiful outdoors and improve our mental health. It's been a long haul. It's been a very long haul, and I think we're all really itching for the end to come as soon as possible.
Just in regards to going back to the Severn Court outbreak, how are the students doing? How are they faring in terms of both their physical health as well as their mental health? Are you aware of that situation?
Well, I'm aware. I mean, we do have the building on lockdown, and we have two groups of students. We've got the cases and the high-risk contacts who are self-isolating, and then we have the group that are under stay-at-home orders, so they can't leave unless it's for essential purposes. I am concerned about the students, and I'm wondering if this might be a good opportunity for our colleagues at Fleming College to say a few words about the students and maybe what we can expect next week going forward. So I'm going to ask Maureen if you'd like to take the floor, please.
Thanks, Rosanna. So students are fatigued like everyone else. This has had a very adverse impact on their progress, although once again, we're committed to getting all of those responsible students across the finish line. We have had some very in-depth conversations with public health as recently as this morning, and it is our intent to re-engage in person beginning next week. We're trying to get that message out to our students and staff momentarily, and we are putting extra cautious further measures in place, I should say, just to really make sure that no one can come on campus that has any kind of symptoms. There will be no online screening. It will be in person. The folks from Severn Court, unless they've been cleared by public health, will not be permitted back on campus.
We're seeing a lot of blame and outrage and anger towards the students that were responsible. And, even in some cases, students that weren't responsible, that were just kind of bystanders who lived in the residence when it happened. How do you feel? But we're also seeing comments, saying, we need to offer forgiveness or we need to let go of our anger on this. How do you feel about the community's response to these kind of different opinions on the outbreak and the students responsible, Maureen?
Well, I think the community has responded out of fear and disappointment for the very few students that were involved in this gathering. And I think it's really important to remind ourselves that it is a few. Fleming College has been part of this community for more than 50 years. We're an active public asset. We work closely with our partners. Our students are proud. Our faculty are proud of our students. And we provide quality education. So I think the disappointment has certainly brought about a lot of anger. But these individuals know who they are, their friends know who they are, their friends' know who they are. And I think it's time that we pivot now and get on with getting across the finish line for those responsible students that we have at Fleming, which are the majority.
Okay, perfect. I think that's all the questions I have for Maureen. Just one last question then for Dr. Salvaterra. You said that, doctors offering the AstraZeneca vaccine is a pilot project. I was speaking with a senior, and they said that they were apprehensive about getting the AstraZeneca vaccine just because of the efficacy of it. It's is not as high as reported in some of the other vaccines that have been approved by Health Canada. What is your recommendation then? What do you think people should do?
Well, the NACI, so the National Advisory Committee on Immunizations, has recommended that for seniors, the recommended vaccines are the Pfizer and the Moderna vaccines, the messenger RNA vaccines. They've been proven in clinical trials to be very effective. And so they recommended that the AstraZeneca only be used in people under the age of 65, as well as only in people who are not high risk. For those high risk individuals or for people who are older, they need the benefit of the messenger RNA to protect them, to give them the level of protection that they need and deserve. So the AstraZeneca is an option. And as I said, part of the pilot is to measure what kind of demand there is out there for a vaccine like AstraZeneca. It's still a 2-dose vaccine. It works about as good as our flu vaccines do. It certainly helps. It certainly prevents hospitalization. So it may not prevent COVID, but it prevents hospitalization. And there may be people out there who are prepared to step forward and get the AstraZeneca because it is available to them now, rather than having to wait an additional few months for the messenger RNA vaccine. So we'll see from the pilot how much appetite there is, and we'll also see how well it works. It is a refrigerated vaccine. It's a lot easier to move AstraZeneca around than it is to move the Pfizer or the Moderna vaccine. So it's got a lot more stability, it's more mobile, more convenient, so we're hoping that there is a role for it in both primary care as well as in pharmacies.
Last question before we move on to my colleagues. Is there just any update on the person connected to Severn Court who was transferred to a Toronto hospital?
No, I'm afraid I don't have any further updates on that individual. I'm very concerned, though. That's not good news.
Okay, that's everything from me. Thank you so much, everyone.
Okay, great. Thanks, Taylor. Okay, we'll now invite Joelle Kovac from the Examiner. If you've got some questions for Dr. Salvaterra, please go ahead.
Yes, thank you very much. With regard to the Severn Court and Champlain outbreaks, I wonder if you can tell us whether there's an update on the public health investigation and also on the police investigation. Thank you.
So, Joelle, we do our investigations on every case that comes forward, and we do that for the purposes of identifying the high-risk contacts. So that's going well from my perspective. We are getting to the contacts in good enough time to try and isolate them and to have them tested. So we're finding more cases there because of that prompt response. And I'll ask John Lyons if he has any update on the police side of it. So over to you, John.
Thank you, Dr. Salvaterra. Yeah, just in regards to that, we are certainly working in unison with public health in this investigation on an almost parallel investigation. We are definitely making sure that any of those involved are primarily being dealt with for their medical issues, if they have any, and to also determine who needs to be isolated and who doesn't. Along the way, we're also making sure that we are gathering pertinent information which will carry the investigation further. But at this point, there's nothing significant to report other than the investigation is ongoing. And as stated, we are in contact with public health on this matter and will continue to do so.
Thank you very much.
Thank you.
Thank you. That's helpful. I had a couple of questions regarding the numbers of vaccines, Dr. Salvaterra. When we see a count of the number of vaccines administered locally, are second doses counting 2 times, or is that one person, 2 doses counts once?
I'm not quite sure what you're referring to, so I'm wondering, Brittany, if you might be able to step in with that.
Sure. I think what Joelle's asking is, when she sees a number, does that include second doses? So are we tracking doses or individuals? And my understanding is that we're tracking doses.
Okay, that's absolutely fair. Is there, this is fine detailed data I'm wondering about, is there any data on how many people have had 1 dose and how many 2? Like, do we know how many people in Peterborough are fully vaccinated at this point, or?
Well, it's actually an easy question, Joelle, because the only people who've had their second doses in Peterborough are the residents of long-term care homes, and we completed them earlier this week. So they've all had their second doses, as well as some of the staff that. I'm trying to remember if we did the staff. Don't quote me on that one, but I can tell you that the residents of long-term care homes have had their second doses. We have not been allowed to proceed with first doses here in Peterborough. As one of the later public health units, we didn't get vaccine until end of January. We were only allowed to do first doses except for those high-risk residents. So, I mean, things are changing quickly and we're getting more vaccine, but I'm very certain that the only ones we've completed with the second dose are those residents.
Okay, that's really, really helpful. And the last thing I wondered about is you mentioned there's 2 mass vaccine clinics happening, or mass immunization clinics happening, one at Evinrude Centre and one in Norwood. And those dates have been released. Is there any more sites that have been selected, or any more details available about forthcoming?
Well, there will be different sites. We will be moving the rural clinics around the different townships to try and improve access and make it more convenient for people. But I will add that as of yesterday, the hospital, so PRHC, has also offered to assist with the 80+ immunization. And so they're going to be transferring over their booking system onto the Ontario COVAX system for next week, so that people who may be going up to the hospital for other reasons might be able to also get their immunization while they're there. So I'm very happy that the hospital is going to be able to assist us as well. So that's one more spot where the 80+ group can get immunized next week.
Thank you very, very much. That's all my questions. Thank you.
Thank you very much, Joelle. Okay, and just to follow up, there are plans to have a more robust vaccination dashboard available on our website that will provide more detail than what we have now. We're just looking to coordinate it in with the COVAX system. So, but stay tuned for that. So let's now hear from our colleagues from Global, and I see Jessica Niznik is on the line. So Jessica, if you've got some questions, please go ahead.
So registering means populating the system. So it's been populated by, so anyone who has a photo ID, you are in the system. They have your information. They have, and so when you become eligible, when you pop in your health card number, it's going to open the door and let you in and take you straight to the scheduler, so that you can then schedule your appointment. And you can choose from the various settings, the different places that we will be immunizing, different dates, times. So people who are not in the scheduler would be people with the old red and white cards that don't have a photo. And for them, they are going to have to get themselves registered. They'll have to do that through the telephone support that we are setting up. Yes, that's right. Yes. Yes, he or she will call you as well as the nurse practitioners. So it's all of the primary care settings. I'm not sure how, I don't have the details as to how much vaccine, how they're dividing it up among them. but I do know that all of them will be participating, and they don't want to get inundated with phone calls. I mean, their phone lines need to be kept open for people who are ill and who are seeking appointments. So please, please don't phone them. They'll phone you. Well, no, you can't say that, Jessica. I think we're going to have to wait and see what happens. I think our local doctors are very creative, and they've got a few ideas that they want to test, and this is the perfect opportunity for them to test them out. I don't think you can equate it. I think there will be more vaccine coming, Jessica. I'm anticipating that the pharmacy pilots that are taking place at the same time, not in Peterborough, but elsewhere, will help determine how to make the vaccine available through pharmacies. And I know it's the provincial intention to have pharmacies help with the delivery of the vaccine. So I wouldn't panic if you don't get one of the 4,500 doses next week. I anticipate that there's going to be lots more where that came from. So we open up the booking system on March the 15th, and I believe our first 80-plus appointment our first 80-plus appointment clinic is on the 19th of March, and they will run every day from the 19th of March. We anticipate we will need until March 25th to get everyone done. Now, so that's what we're planning right now. But again, not to worry, because our city and county clinics will continue to operate. They're not going anywhere. We're setting them up, and we expect that we will be immunizing for the next several months.
My understanding, and Dr. Salvatierra might actually know this more than I, but is that when we show a number of resolved cases, that's total. That's total numbers for all variants and a case that's not a variant. It's just the total number of resolved cases.
I think what you mean is that there are more variants than active cases, and that's, yes, and that's because we're keeping a running total of the cases that have tested positive for a variant of concern. So cases do resolve after 10 weeks. If it's a mild case, we clear them. They're no longer active, but if they were a variant of concern, they're still counted as a variant.
Okay, thanks. Thanks, Jessica. Okay, Mark Junta from Global. Do you have some questions for Dr. Salvatierra?
Yes, I do. Just wondering, the case count at Severn Court, I mean, it's now 56. It seems like it's slowing down. Would you agree that it's slowing down? And if so, is your concern at all dropping that we won't see the hundreds of cases that we possibly thought about in the beginning?
So it is, the virus is running its course in the building, and we're managing to keep people, they're self-isolating, so they're not spreading it around the building any further. However, this variant is out in the community. We have lots of cases that we're not counting as part of that are now taking place in the community. And that's because there was someone who was exposed, who then lives with others in the community, and now their whole household is ill, and now somebody's been there and has gone somewhere else, and they've spread it again. So that number that we use is an underrepresentation of the true outbreak. We only count those people who were residents of Severn Court. We're not counting all of the other community people who are either infected now or who've been infected or are to be infected. That's something that takes a lot of work to do to show that relationship, but at some point we will be able to show how much this has spread into our community.
So preliminarily, do you have kind of an idea? Is there quite a bit of community spread from this outbreak?
Yes, there is. I mean, just by looking at the variants of concern and to see how big that number is getting, we have lots of cases in the community. Lots of them are variants, and many of them can be linked to the exposure at Severn Court.
We know the outbreak at Champlain College is related. Is there any other cases, let's say in workplace settings, that we know are related to Severn Court as well?
We've had cases in workplaces that we have investigated. Fortunately, up until now, we've had no transmission in those workplaces. So we continue to investigate, and we will definitely let the community know if we have concerns about potential spread in workplaces.
The person that's hospitalized, can you say whether or not they are a resident of Severn Court or a community member affected by the outbreak?
They were a resident of Severn Court.
Okay, and just on the variants at Severn Court, do we have a number as of the 56 that we know are VOC?
I would have to ask our staff for that. They do have that number. I just didn't include it today in my comments.
Actually, I do have that number. I did check with our epidemiologist, and he reported 44 of the cases were variants of concern related to the Severn Court outbreak.
Thanks, Brittany.
Okay, that's pretty much it for me. Thank you so much.
Great, thank you, Mark. So now on to Greg Davis. Do you have questions for Dr. Salvaterra? Go ahead, Greg, if so. Maybe you're still on mute. Okay, well, maybe we'll come back to Greg. Then the next one I will invite is Reg Watson from the Examiner. Did you have any questions today?
No, thanks.
Okay, thank you. Okay, so I'm not hearing from Greg, but he's welcome to follow up with me after this. Okay, so on that note, I think that wraps us up. Just another reminder about the March 18th vaccine information event